Imagine a world where a life-saving tool is just a few steps away from anyone who needs it. No questions asked, no barriers to entry. That's the vision driving Kansas Attorney General Kris Kobach, who's pushing to turn unused news racks into naloxone distribution hubs. But here's where it gets controversial. Critics argue this approach might downplay the root causes of the opioid crisis. Should we focus on prevention, or is expanding access to naloxone the most urgent step? Let's dive in. Naloxone, often sold under the brand name Narcan, is a game changer. It's a nasal spray that can reverse an opioid overdose within minutes, potentially saving a life before emergency services arrive. Kobach, who keeps a stash in his truck's glove box, wants to make this medication as accessible as a candy bar from a vending machine. His plan? Repurpose old newspaper stands across the state into free naloxone dispensers. The idea isn't new. Emily's Hope, a South Dakota nonprofit, pioneered this strategy. Since 2023, they've placed 25 open boxes in 11 cities, distributing nearly 8,200 kits. Angela Kennecke, the organization's CEO, calls it extremely successful. Kobach, inspired by their model, aims to replicate it in Kansas, targeting college campuses and high-risk areas. Why the urgency? Fentanyl, a synthetic opioid 50 times stronger than heroin, is fueling the crisis. In 2023 alone, it caused over 60% of overdose deaths in Kansas, surpassing 1,500 total fatalities. Shockingly, nearly half of these deaths had a bystander present, someone who could have acted but didn't. We need to empower people to act, Kobach said at a recent grant review board meeting. The state's $177,000 grant will fund public service campaigns, social media ads, and 7,000 naloxone kits. But here's the twist. Almost 85% of the budget, $150,000, will go to advertising. Critics might ask, shouldn't the money prioritize direct distribution? Kobach argues education is key. Fentanyl often hides in counterfeit pills, and many users don't realize the risks. This isn't just about handing out kits, he said. It's about changing mindsets. Meanwhile, the Douglas County-based DCCCA is already making waves. Their naloxone vending machines, which dispense kits like snacks, have distributed 40,000 kits since 2023. Users simply enter their zip code, and a kit pops out. Surprisingly, many users come from affluent areas, challenging stereotypes about who's affected. Opioid addiction doesn't care about your address, said Chrissy Mayer, DCCCA's Community Services Officer. But the debate rages on. Some argue naloxone access could enable risky behavior. Others counter that it's a moral imperative. Your zip code doesn't matter, Mayer insists. This is a human crisis, not a geographic one. As Kansas moves forward, the state will test its naloxone initiative at the Kansas State Fair in September. Will this bold experiment save lives, or will it spark more questions than answers? We'd love to hear your take. Is expanding naloxone access the right move, or does it risk ignoring deeper issues? Share your thoughts below.